Hi, my name's Brianna Jarvis, and I'm going to be talking to you guys today about how ADHD and anxiety disorder can comorbidly occur with each other, and an alternative method that can help to offset the symptoms of them and help you kind of deal with them a little bit. So, having ADHD can put you at more of an elevated risk for having anxiety disorders. So first of all, let's talk about what ADHD is. So ADHD stands for Attention Deficit Hyperactivity Disorder. And it is a psychiatric disorder. It's characterized by severe impairing levels of inattention, hyperactivity, and impulsivity. I actually am somebody who struggles with ADHD and anxiety disorder together. So that is why I decided to talk to you guys about this topic today. I was hoping it might be a way for you guys to maybe understand it a little bit more, or maybe understand it if you know anybody who does struggle with either of these, anxiety or ADHD. And also, so ADHD appears in childhood. It's usually associated with struggling more with peers and contributing to functional impairment, academically, socially, and behaviorally. It's also once believed to be a childhood disorder, but it does present in adults, and commonly it is actually misdiagnosed in adults a lot because sometimes it can kind of present itself a bit more in childhood, especially in the school environment. It tends to have kids struggle a little bit more academically, but that's not always the case. It wasn't actually the case for myself. So that's why that's something that didn't actually... I didn't actually think about that, and my parents didn't either, so I didn't actually figure out that it was something that I struggled with until about 3 years ago or so. So there's actually increasing evidence that anxiety does increase impairments with children with ADHD, so ADHD can kind of or anxiety can exacerbate some of the symptoms of ADHD, which is why we'll be talking about ways that you can kind of deal with anxiety that could also help you kind of deal with some impairments with ADHD. So about approximately 25% of children with ADHD qualify for one or several different types of anxiety disorders. When they have both together, there tends to be more executive dysfunction, school functioning, poor quality of life, more strained family relationships, especially if there are multiple people in the home with ADHD together. And like I said, managing your anxiety may be a good way to kind of improve the functioning of children with ADHD or adolescents and adults as well. So when you're managing ADHD and anxiety together, doctors do tend to typically prescribe medications. That's usually the first alternative method that they choose to go with. However, studies have shown that a lot of times medications don't always work for everybody. It tends to not work quite as well as things like cognitive behavioral therapy, which is what I wanted to talk more about today. So cognitive behavioral therapy is a way to kind of allow kids, adolescents, or adults to improve on different kinds of things like their management, their attention, and hyperactivity. It has shown to be the strongest support of management for pediatric anxiety. There's a small number of pre- and post studies reported that it does improve anxiety in children. And then according to one study, it examined 14 different children with anxiety, comorbid anxiety and ADHD. There was so out of the 14, 7 of the children who went through cognitive behavioral therapy actually decreased their symptoms of anxiety, or the anxiety just kind of went away altogether. And then for the children who had the usual care, 12 out of 11 still had, or 11 out of 12 still had anxiety symptoms or anxiety disorder. So it showed that the cognitive behavioral therapy actually worked a lot better than usual methods of trying to deal with these disorders. And these including the fact that treating anxiety was a useful way of symptoms of ADHD, and anxiety can also be a symptom of ADHD. Not only can cognitive behavioral therapy help with anxiety, it can also help with targeting ADHD symptoms. So you don't have to necessarily have anxiety and ADHD together to try to combat anxiety with the cognitive behavioral therapy. You can also specifically target ADHD with the cognitive behavioral therapy as well. So there was one study, had tons of different treatment packages where there was different types of cognitive behavioral therapy given. But one of them resulted in a large effect size on the total ADHD symptoms. And one of the packages also consisted of 3 core modules of treatment, which was organizing and planning, reducing distractibility, and adaptive thinking. So with targeting all of those things, it helped adults who were randomized to cognitive behavioral therapy had lower ADHD symptoms than those who relied on just medications alone. So overall, ADHD and anxiety can be hard disorders to manage, but finding the right methods can be really helpful. A lot of people, I feel like, don't know that there are other methods out there like cognitive behavioral therapy. That's not something that I really knew about until I started doing research on this for this project. So a lot of people would go immediately to finding like the right drugs for their kids or themselves, looking for alternative methods. So this is, something I've struggled with as well, is trying to find medications. So now after doing this project, I definitely would like to look into doing some other things like the cognitive behavioral therapy. And maybe this is something too that if you know anybody who struggles with either of these things, something to give them some information about. I think it would have been cool if I'd known about it before too. But I hope if you also suffer from either of these, or anybody that does, you have maybe a better understanding of what ADHD is and how these can occur together. But yeah.